Hi, welcome to another knee moment from Knee Fit and 5 and MSM Products. My name is Dr. Matt Lawless.
And I'm Scott Johnson with Physical Therapy.
So we had a patient write in, her name was Casey. She's 35 years old. She said she was recently diagnosed with patellofemoral pain. She wanted to know what patellofemoral pain was and what the treatment for it was. They said she was supposed to go to physical therapy. Well, Casey, you have a very common problem. The American Journal of Sports Medicine in 2002 quoted that there is as many as 7 to 15% of the population has patellofemoral pain. So patellofemoral pain is kind of a grab bag for pain in the front of your knee. So what causes the pain, no one actually really knows exactly what causes patellofemoral pain. And it might be a lot of different things, or no one really knows. It's been hypothesized that it might be the anterior fat pad, so the fat right behind your patellar tendon. It might be the synovium in your knee. It might be the medial and lateral retinaculum in your knee. It might be the subchondral bone of your kneecap. But no one really knows what causes the actual pain. But it does hurt in the front of your knee. And what we do know from that same article I cited previously is that physical therapy works. That study was done in 2002, so it was done a long time ago. But they had a 6-week course of physical therapy, and the people that had the physical therapy got better, and the people that didn't have the physical therapy didn't get better. So Scott, let me ask you, what do you think about physical therapy, and what do you tell the patients to do?
I agree with you. It does help, and it is interesting. We don't really know exactly where the source of pain is coming from, but we do know that strengthening exercises and flexibility exercises and core strengthening exercises are helpful. We try to look. I know you're having knee pain, and so a lot of times you just try to focus on things that are around the knee, but you really need to look at the person as a whole. And look above the knee and look below the knee and focus on some things that might be weak. Maybe there's some flexibility issues there. And so we're working on more than just the muscles around the knee. And so we're doing some strengthening exercises for the quad muscles which surround the knee, but we're also doing strengthening exercises for the hip. Matter of fact, in the Journal of Sports Rehabilitation in 2017, there was a study that indicated that doing hip strengthening and quadricep strengthening was very, very beneficial for people who had patellofemoral pain. Another interesting study that they did in the Journal of Athletic Training in 2015 was they compared patients that were just getting hip and core strengthening versus patients that were just getting exercises for the muscles that surrounded their knee. And they both had very good results by following those routines. And so if I were to summarize that answer, we look at you as a whole. I look at you above the knee, I look at you below the knee, and I'm focusing on core strengthening, I'm focusing on hip strengthening, I'm focusing on quadricep strengthening, which are the muscles in the front of your thigh, but I'm also looking at flexibility, especially the quadricep muscles, the hamstring muscles, the calf muscles. All that kind of seems to help if we look at the patient as a whole, and we go from there. And so that's why with the Knee Fit and 5 program, it encompasses all of that. It has flexibility, it has balance, it has core strengthening, it has, of course, the strengthening exercises in it, and so that seems to work great.
Good. So essentially we're working on the ground up. You're taking everything in contact with the ground, taking it all the way up to the core, and that's how we're treating the patellofemoral pain.
Absolutely.
But the good news is it does get better, and the therapy doesn't do anything to harm it. So even though people might get sore doing some of the exercises, you're not doing any damage to it. And we do know in the long run that if you stay consistent with your exercises, your knee pain will improve, your function will improve, and you will do much better.